Yep.
Welcome to the Only Healthcare Podcast. I am Michael Navin, joined by my co-host Randy Vogenberg, and we are very delighted to have Lynn Hanessian join us today. Lynn is the founder of a recently developed consultancy called Engager. Lynn had spent 28 years at her previous company building communications platforms, launching products, and the new company is focused on really organizations to engage new audiences, position themselves for growth, build reputations, product launches, shape markets, and build and combine these in the healthcare industry expertise that she brings around creative communications and strategic foresight. So Lynn, we're really excited to have you. We're excited to talk about the topics. We certainly want you to build up your company a little bit and your background before we get into more detail, but then Randy will take it away. So Lynn, the floor is yours, and welcome to the Only Healthcare Podcast.
Thank you so much, and thank you for inviting me to participate in the conversation. As I was getting ready to log on just today, one of the topics I hope we're going to talk about is transparency and employers. I saw the launch of another consultancy that's trying to help employers with fiduciary responsibility wend their way through the opacity of life in healthcare spending. So I conveniently have a degree that uniquely equips me to be effective in healthcare. I have a degree in economics. And with that, I launched in very early in my career to health and health sector, everything from social determinants of health and bench research in oncology into professional medical societies, the marketing, communications, and strategy. My entire life has been really focused on the that fun sector of our economy, healthcare, and all of the decisions that go into it. How does the right patient get to the right care provider at the right time for the best outcome? I think that's a dream that we all hope to have, and certainly one in which we get people to the right place at the right time. And I think that's one of the more interesting things that we're facing today, as I can do everything from my couch. I could buy a house. I could refinance my house. I could sell my house. I could buy a car. I can do almost any transaction in my life except really master my healthcare. So it's a really exciting time to see how maybe the stressors on the healthcare system might accelerate transformation in a way that meets all the stakeholder needs. And of course, we're at such an interesting time of stress and strain that maybe that stress and strain may beget good solutions. So that's me. And I had been, as Michael, as you noted, I had been with a global communications company for 28 years. And finally, I got to the point where I said, hey, I'm a grown-up now. I'm going to launch my own endeavor and really focus on engagement, because I think that's what's really, really critical right now. It's really important for all sides of that healthcare conversation to come together, understand where they are, and understand solutions that might help us do much better with the resources we're already devoting to this enterprise called healthcare.
When you say engagement, who is the primary focus for the engagement?
So, Michael, that's a really great question, because I think what we have found today is that the evolution of authority and influence has really, really changed. So one of the things that I do with my clients is try to identify who are your critical audiences. Where are they right now in relation to the conversation you want to have? How do we get them to the table, and how do we get to an outcome based on evidence that is a win-win? So in some situations, it may be the payer and the patient together able to drive forces. In some cases, it may be a professional community that's grappling with implementing new guidelines, dealing with scarcity of resources, and how do we get them together with maybe health systems to try and figure out a solution. And frankly, given the shifting dynamics of the U.S. right now, in some cases, we're asking some people to take on new roles. And so it's something where people have to step back and really take a fresh look at what are the hurdles to their success, and what are the possible novel solutions, because I would say our stakeholders are restless and looking for new solutions. So it really depends on the situation, Michael. If I'm bringing a new product to market versus trying to roll out benefits with a client versus trying to help establish a new standard of care, There's a special recipe for each one.
It's interesting. We focus a lot in working with employers, employer benefit consultants, and what I find very interesting is some of the larger groups that we deal with. They don't want the patient to really be involved, right? They provide the resources to guide the patient, and it's interesting because, as you know, over the last 25 plus years, the cost burden has shifted onto the patient. But the information that they're given is very suspect, right?
Yeah.
At best. And so, how do you take that dynamic where, a consultancy is paid to, manage and work and help the patient, right? So their head's in the right space.
Right.
But at the end of the day, it's you're holding someone's hand, right? You're becoming a codependent relationship versus allowing that patient to sort of have information, to be able to ask the right questions of whether it's cost, whether it's the treatment, whatever the case may be. Is that something that you guys are working on?
Yeah, Michael, that's a really important point. And I think it all depends on sort of which part of the elephant we're touching here. Because I think that for all employers, their goal is to have the best possible outcome. And the goal is, what tools do you have to provide for your patient? A patient who's pursuing a procedure, that may be the very first time that they're doing that. And they may not have the tools to be able to ask those questions in particular. And so I think what I like to sort of really advocate for is, the whole places where we get information have changed very dramatically. And in no other topic has the change been more profound than healthcare. The number of people who have switched from web search to generative engine search, that topic is the number one switch point. A dramatic shift. If you're only focused on web, then you've lost the plot. And that says to me that we've got a lot of covered lives who are eager, looking for information. One of my favorite examples is one of the top 20 pharma companies a couple of years ago, when AI was coming into focus. We're very green fields about it. Everyone go apply it to your workforce. And they came down to sort of 3 solutions, and they could do it in anything. You could do it for your external engagement, for your sales, for your R&D. And one of the top 3 solutions was helping their employees navigate their benefits, because they were getting 10 million inquiries a year from their global workforce. And that's where AI helped their patients navigate. So there's new tools to help with that navigation. I don't know that I had the great opportunity to present to a bunch of benefits and rewards specialists in May. And I asked them, I said, how many of you are covering GLP-1s? Some hands went up. How many of you aren't? Hands, couple. How many will? Some went up. And then I asked the most important question, how many of you used to and you stopped? And hands went up. And the reason why is that we may not have the right tools in place to make that spending really worthwhile. And I think that that's the catch-22 that so many employers are in right now, keeping the doors open while dealing with really rough economic factors. And that's going to be a big play in this year. I mean, we all know the average American does not have $400 in the bank to deal with an unexpected expense. And about half the people who have employer-provided health insurance still say they find it to be unaffordable. And that's not, that's the market basket. If I'm trying to make, critical decisions about rent versus food versus other things, now we have a whole extra set of stressors on that population we're trying to keep well. So, it really depends on how we equip, our stakeholders to facilitate that journey to the endpoint we're looking for.
Yeah, it's interesting you bring up some of those points, because when you think about optimal care management, which is one of the topics that you touched on already, everybody kind of defaults to, it's the healthcare system providers. Is it the physician? Is it the hospital? Is it the clinic? Is it all those things? Is it the patient themselves? But I think it's kind of what you're getting at, and they got kind of lost, even in the healthcare companies, whether it was a manufacturer that you were illustrating. And I've seen the same thing happen over and over again over the years with hospitals. They have the biggest problem with their benefits. Educational institutions, where a lot of the thought leaders come from, they have the same problem. So I think you really hit on something here around this whole way in which we find information and then hopefully act on it in the right way. And how do you align those different stakeholders, which I think is another area that you're
Randy,
looking at.
Randy, you touch on a really good point. I think, I sort of think about a pressure cooker that we're in right now, and whether or not that will facilitate conversations and solutions that people hadn't thought about now. Because if we look at, and I've got a list of the upcoming PDUFA dates in the year ahead, and there's some remarkable things that may happen, and there's some expensive things that may happen. And how do we ensure that we've got the sort of right anticipation of that? And how do we help our covered lives get to sort of their best productive state? And it is complicated. I mean, I sit in an urban area that's got a pile of academic medicine institutions and other notable systems. And how do you choose? My son was home this summer from his first job. He's got a pretty good coverage. It's an HMO, and he sprained his ankle. And we had to sit around and figure out, well, where do we take him? And in fact, it was cheaper to take him to the ED than it was to take him to urgent care because of how the plan was designed. And so, that's higher level math. That's not something you want to have to be working through when what you're trying to do is take care of a loved one. Thankfully, it was not a really urgent situation, and his ankle is fully healed. But it's that complexity, Randy, that you mentioned. You don't understand. I mean, it's the old sort of in-network versus out-of-network anesthesiologist when you go in for a procedure and get surprised by the bill afterwards. Yeah. We shouldn't be grappling with that today. And I don't know any stakeholder that's happy with the state of affairs.
Do any of the tools help? So we're involved in some of the technology that has all the pricing for drugs and for services. Have you engaged any of those resources? Have you worked with those resources with some of your clients, and are they having an impact?
So I have to say, so I because this thing called technology is accelerating so quickly, and the tools you have at hand, just as a consumer or an advisor, have changed so dramatically. I brushed up my skills this summer, and I think what we're finding is there's a whole new set of use cases available, and then the benefits year starts again, and you've got to go back to square one for some people as you've seen changes. And I saw a bunch of changes in PBM relationships. I was surprised. I don't know who's got the numbers about the volume on that. But it really feels to me like the tools that I have seen that have been most effective are people who have a well-characterized problem they're trying to solve, and then explore a couple of avenues, including using some of the new every day it's new again, some of the new AI agents that can be they're unvetted in outside of an enterprise space, and they require an extra set of testing or verification. But I frankly think what I'm seeing is an effort to try and find and Michael, you and Randy may have a better perspective on this than I do, but really just getting to transparency to understand what's under the hood of the plans.
No, we do, and I think that's what's interesting is a lot of it's education, but there is information out there, and
right.
In sort of the issue you just talked about, which is plan design year changes. You go into January, okay, your deductible resets, but it doesn't cost any more to get an MRI at one facility versus another unless they're just trying to charge more, right? At the end of the day, it's still the same procedure,
right? And
so some of these tools, like we work with one that is that based on procedural codes, you could put in the ICD-10 code.
Right.
You could type in the actual procedure. It will tell you to the dollar what that facility is charging. So if you're, in your case, your example of, well, the ED is probably more expensive than the urgent care, but you found out the urgent care was more expensive than the ED. But if you had this tool, it would show you what the cost should be.
Right.
And then you should, as a consumer, be able to
Right.
go in and say, hey, I'm not paying more than $200 for this. So
Right.
I don't know where you're getting your pricing from, but I have your pricing right here. So no one goes in and challenges the pricing.
Right.
No one even asks the price
Right.
until you get the bill.
Right.
My daughter recently, last year, had, she goes to college in South Carolina, and she went to the university medical center for, or the actual hospital because she thought she had pneumonia, and they did an EKG that they charged $2,000 for. And I simply said, I'm not paying $2,000. You guys can send us to collections. You could do whatever you want. An EKG is $150 procedure at most, not including the doctor time. So do whatever you want, but I'm not paying it.
Right.
So I had the information to go back and say that.
Right. And Michael, that gets back to your point of then they don't want the patient involved. This is a set of skills and knowledge that has to be shared with the patient. Mm-hmm. And you have to equip them. Yes. I mean, you have to give them the skill set to be a healthcare engager and a healthcare consumer.
Correct.
And I think that is one of the real challenges. Mm-hmm. And I think there's I can manage my grocery budget because every week I get a new sales circular and I can decide what I'm going to do. And I have deep knowledge of what I'm doing. But if you're having a first-time procedure or a first-time engagement with a health system or provider, that's a steep learning curve. And so I do think that the part of the triangulation here is how do we bring the interested and the urgent to the table to find use cases that then accelerate sort of not only the skill development, but then the behavior change and the cost accountability.
Yep.
Yeah, I think you see some of the same issues even in the Medicare program that everybody raves about. You get a reset every year, this year in particular, and it's expected to be even more change next year. So not only for the younger people, like a college student or somebody who's still in the workforce, but for retirees, that's another level of problem. So you have different kinds of consumers that are all having first-time events with the healthcare system. And kind of listening to the conversation so far, what kind of jumped out of my mind is the old adage of the parent-child relationship that healthcare providers typically have. And now it's been extended to all the third-party administrators that kind of do the same thing. They don't engage with the consumer nor consider the consumer in what they do. So is that something you're also looking at, is that change in dynamic that needs to happen in addition to the consumer being more engaged themselves?
Even though I like to think of myself as very cynical, my mother says I'm an optimist, which it's shocking to me that she would say that. But I do have a sort of sense that I'm an optimist, but maybe I'm a realist here too. The kinds of tools, the kinds of sort of reliability of limited change year to year, and I'm talking over. I mean, if you think about where your seniors are getting information, how they're engaging in their behaviors versus someone in college, fresh out of college, establishing relationships, you've got to segment who your considerations are. But there is a real need to think about how to get people involved in new behaviors and new actions. And I think the other pressure cooker, frankly, is helping people to understand cost. Now, I'm a bit obsessed about the K-shaped economy and the direct to consumer sales of medications in particular, because I deeply worry about haves and have-nots in that situation. I mean, we know that people who have resources and education are more likely to trust their healthcare system, are more likely to be engaged. And we certainly know that that employers are deeply dedicated to trying to equip their workforces with what they need. But if you think about, I participated in some conversations with employers who have highly mobile, they've got delivery people on the road all the year. And the level of complexity that they engage in, crossing state lines, having appropriate coverage, encountering, heat waves or as I look outside my windows, cold waves, you right. And
Yeah.
the role of the employer to
Snowstorms.
be the source of information and truth, because that's the other problem. Other sources of information that used to surround
Right.
us and help us are not really there for us anymore. In the way that they used to be. There's not as much of a sort of, people, as I always say, you're only going to miss it when it's gone. People are learning now that that sort of subtle public health messaging that was so important to us is not as forward and present as it used to be.
Yeah. Yeah, there's been a lot of societal change, and a lot of times when I'm talking with different parts of the stakeholder system in healthcare, this line that became established before COVID, during COVID, and after COVID. So we're in the after COVID period, and we really had an acceleration of a lot of different things happening. You mentioned AI as an example. I mean, that's certainly driving the stock market these days. But really, we're at a very early stage with a lot of the AI. We have a long way to go, a lot of potential. But meanwhile, today, if something happened to you and you had to go in the healthcare system, it's the same old, if not worse, healthcare system, even with the computers they have. And everybody's got stories going into their, if it's primary care or a specialist, if you can get into a specialist. So some of these other dynamics of, do we have enough healthcare professionals to take on the volume of patients that are now seeking care of all ages? It's not, again, not just retirees or those with employers. And we've seen part of the response with employers being, well, we'll set up our own clinics if we're big enough, or we're in an area where we can share a service. So we're seeing some other changes coming, initiated by the employer on behalf of their employees, to your point. But then you're back to, okay, they have something potentially that's working if they're in the same area, not traveling. But then you have the have-nots as well, that maybe aren't employed or are independent contractors, because we now have the gig economy, which is very big. So what are your thoughts around some of that transition that's affecting the consumers of healthcare, and how they're not only getting information, but getting care?
It's complicated, and it's generational, because I think people, I mean, the ability, I mean, maybe my gray hair doesn't suggest it enough, but the ability just to walk right into the pharmacy counter and say, hey, I want a handful of vaccines without having seen my doctor is a great thing. The ability to access care in different places, really important. I almost think that we need to consider how, this is going to date me even further. In the 80s, when I worked for a professional medical society, we were beginning to plan for an electronic medical record. And I said to my bosses, why do we need this? Well, one day there's going to be this thing, and it's going to help us, and it's going to be all connected, and it's going to bring all this information together. And I think people have to, think about their own information hygiene and their own health hygiene. But I worry deeply that you've got these point of purchase decisions that are really excruciating and really difficult for people. I sit on the board of a national organization that supports people living with allergies and asthma. And that, point of purchase, arguing for coverage for your inhaler, that's had some very tragic outcomes. So I frankly think that that some consumer pressure is going to make it happen. But I also think I'm seeing physician demand. I'm also seeing a growing number of people with medical backgrounds run for office so that they can shape policy as well. So I don't have a single point solution here, but I think the pressures are so big that that people are going to begin to sort of navigate where they can. And there are more places where people can get care. Now that, erodes the Marcus Welby, I'll have the same doctor all my life. And that even more urgently makes it critical for people to have the information they have about their health so that they can equip that next provider to make the next step for them as they move on move along. But the cost thing is not good, and the capacity is not good.
Yeah. Affordability, accessibility. In the area that I'm in, it's kind of a semi-urban area, smaller city, but
Right.
within 5 minutes, you're in rural
Right.
counties, and healthcare just drops off a cliff once you get into these rural areas. And so there's that also that
Yeah.
people are really struggling with. How do we deal with that? How do you really optimize some of this technology?
Yeah.
And I think we still have a long way to go.
Yeah,
before that really
I
turns
am a little
the
bit
corner.
hopeful though that one of the places where I'm more bullish when it comes to technology, not only in sort of information management, but frankly is new formats of care. I mean, telemedicine can be a potential godsend, but I also think,
Mhm.
if we've already touched on here, part of it is teaching that skill, and then part of it is helping people to determine where to go for what and when. I think people, if you choose, how am I going to have what am I going to do for dinner tonight? There's a number of different options that you already know in your head. This is going to be expensive. This is going to be cheap. This is going to be fast. This is going to be convenient. Based on your skills, you make a decision. That's the kind of skill set we need to be cultivating in folks, and not, in creating a bit more of a collaboration between the consumer and their care teams or care funders.
Mhm. Yeah, I guess the last piece on this that I wanted to ask about is the expectations component. So the expectations not only of the consumer, and you're kind of touching on this, but
Yeah,
also of the healthcare provider. What are
yeah,
their expectations of what their encounter is going to be with the patient uh, or the person that's seeking care? There seems to be almost a widening of the gap
mm-hmm.
from where we were
Yeah. I
pre-COVID
think
to the
I'm
post-COVID.
gonna go back to the age card as well. Having having worked in academic medicine at the beginning of my career, um, you have the opportunity cost to adopt new behaviors is really, really hard when you're, in your 50s, at the top of the game, the head of the practice, the head of the department. um, so I think there may be trade-offs regarding your provider team skill set and your patient skill set. And so, again, I think about this from the
Mhm.
perspective of the employer, because they are the source of funding for so much of the care. They are also the most trusted agent in this whole ecosystem, and there is just so much noise and misinformation. And I've
Mhm.
heard this directly from docs who, and this is not something to be overlooked. When you are helping your cancer patient understand why it's important to get a flu shot, when they come rolling into the appointment and say, well, doctor, you're only recommending that because you make money off of it, you realize that misinformation has a cost. It has a time cost.
Mhm.
And so if we can build some of that critical authority
Mhm.
in the, and help consumers to understand who to ask questions of and who to trust or who to engage with, then we're in a better place. And I've been talking to health systems all year about the need for their voices from a public health perspective, and that's a new skill for some. Um,
Mhm.
but that's the gateway into
Yeah.
care for the people in the communities that they serve. And for the employers, I think that's a
That,
it's you open up a plethora of opportunities when you lay out your benefits and have opportunities for patients, for your covered lives. You don't always know if they know how to use it, and having a better sense on how that money is spent, and the quality that comes out of that it just
mhm.
has to happen. That there is not an effective Yelp for
Yeah,
healthcare in the way in the way that you can
that's
discern,
great.
at least from a restaurant
Yeah.
review, whether or not this might be when you're experienced with some of those review sites, you can figure out, well, if they don't like it, oh, it's because of the service, it's not because of the food, or it's because the delivery is bad, but I'm eating in, right? So if we can figure out how to free up that information, it would be great.
Mhm. Yeah, that's a great point. Yet another gap that exists out there, and trying to to help consumers be more informed. There, the other thing that's come up that I wanted to touch on in the time that we had, the annual JPMorgan 2026 conference that just recently happened, and there were a lot of conversations as usual about AI, obesity, and so on and so forth. So I was curious because I know you were following that. You did some posting as well. But what were a couple of the key things, particularly when you're thinking through that lens of the employer and what's going to be coming at them in terms of healthcare, and a lot of it's going to be healthcare changed that they're not really prepared for.
Randy, it's a really great question, and that's the reason why I have the list of what are the PDUFAs coming in the next 9 months. Right.
And PDUFAs are how FDA lines up
the date when their decision should be made. Right. Although there are a number that are being pushed back.
Right.
I think the whole obesity category, that's a big area of focus. There are a lot of cancer therapies coming, and there is a segment of relations, not just retirees who have cancer and who are living longer with more treatment options and more complexity. That has to be an area of focus. And you have you still have a bunch of real small population drugs, rare disease drugs that are coming along. The sense that I had was you've got some big shoppers out there, right? So you've got big pharma, it's got a lot of gaps to fill, and they're going to spend some money to do it. There's a little bit less uncertainty on what this administration is going to do. So supply chains and tariffs have been, at least they have a better sense of what they're working with. But there's a lot of hope on the horizon of what the possibilities are. And on the other side of the gaps, right, from an employer perspective, you've got stuff that's going to go generic, which is going to be great news. You've got some really important, powerful medications that are life-changing therapies that are going to be more accessible financially. I thought it was interesting. I also thought that the number of health systems, of course, the big health systems show up and share their information, that are using all sorts of AI tools. I mean, I don't know how. I do wonder if one is going to be faced with herding cats when it comes to AI applications, and how people are measuring the effectiveness of those. And going back to your example of rural divide, the digital divide will also be a problem for people who are, for populations who are unable to sort of access those tools. But finding ways to lessen the load on healthcare providers who are stressed out and capacity strained, it is where I'm seeing some of the greatest hope. And maybe the technology solutions will make a big difference. The former president of the AMA just put up had an interview in Stat News that also shows that he's of course, he now works for an AI company, but in radiology, that's a great solution. And, we've heard real opportunities to make a positive difference. Right. I think in every situation, and this is going to be the challenge, how do you identify those outliers? How do you identify the I don't know whether it's anywhere between 1% or 20% of patients that are going to need more, versus you're able to prioritize sort of a different pathway for them. And I think that's the next opportunity, is to really figure out if we can get the bulk of Americans into a new model of care delivery, while we're not leaving behind those that are best going to be handled by a health system that was designed many decades ago, may not meet the needs of most, but can meet the needs of a few with good outcomes. But I think for employers, there's a lot of stuff coming. Yeah. And a lot in ophthalmology. You got dry eye, you got a lot glaucoma, all sorts of stuff in that area, which I had not been tracking as closely, but I am now.
Yeah. And also a lot of the other specialties. So we've gotten away. There's the oncology, then there's the non-oncology, and that number of options, which includes the ophthalmology that you just mentioned.
Right.
They have all grown, and they're going to continue to grow, which I think a lot of employers, to your point, really aren't aware of the breadth of this change that's happening.
Yeah.
And the new solutions that will be available.
Well, and I think
for problems that we didn't have.
Randy, I think that brings up a really great point. One of those is
Yeah, go ahead.
the tension between the generalist and the subspecialist. So we had spoken to some oncologists last year that are being pressed to serve as generalists while their specialty area may be in breast or maybe in hematology. And I was surprised to find that even in academic centers, and we all have those individual personal cases that are examples of that, where you're was with a loved one and they were. I had done research on the doctor that was assigned to them in a very good health system, a plan that holds the risk. And and I looked at it and said, well, he's talking to you about a blood cancer, but I'm pretty sure he's a breast cancer specialist. And sure enough, I felt terrible that this oncologist was pressed into a hematology consult. And I could tell he was reading off the guidelines while we were doing the video appointment. So, I just think it's an even greater argument to make sure that the care that's being provided is the right care with the best outcome. And that people know where to turn for what. I mean, in some cases, in my household, there is one healthcare consumer, much greater healthcare consumer than the other, and we prepare for that. But that's a complicated thing to prepare for.
Yeah. Yeah, and I would think that most people can relate to that, whether they're taking care of someone in their family or their loved one, particularly the baby boomer group. Are also taking care of our parents as well as our children and maybe grandchildren. So there's a lot of multi-generational just within single families sometimes. Lots of different conditions. So we could go on and on. I think for us, I know we love to delve into this. There's a lot of policy considerations, and for the employers that we've touched on several different ways and times. Hopefully, this is informational for them as well as a lot of the other key stakeholders. This whole issue of engagement is very broad, and I think your points around the skill sets that need to be looked at, developed, and nurtured is something that isn't always talked about. Some of the soft skills that people sometimes talk about from an employer perspective. But that's another area where probably needs more time and attention. So that it gives you a lot of opportunity with your new consultancy, I'm sure. So it's been great talking with you on the Only Healthcare podcast, Lynn, and hope to have you on again. And for our audience, hope you enjoyed this episode of the Only Healthcare podcast. And please follow us, and you can go to our website at onlyhealthcarepodcast.com.
Thank you, Randy.
Thank you for tuning in to the Only Healthcare podcast. We hope you found today's episode insightful and informative. Remember, our mission is to provide actionable and inspirational insights on how we can improve healthcare cost, care, and accessibility for all. If you enjoyed this episode, please subscribe, rate, and share with your friends and family. For more resources and updates, visit us at onlyhealthcarepodcast.com. We'd love to hear from you. Let us know what topics you'd like us to discuss in future episodes. Until next time, stay informed, and together, let's navigate the journey to better healthcare.